A $500 million deficit is something leaders for the state health plan are trying to figure out how to handle. One of the solutions they brought up is to raise prices for the people covered under that plan. WRAL Sean Gallagher covering this for us today. Sean, a lot of the people you spoke to are teachers. These are people who say they're already underpaid, and this isn't going to help.
Yeah, that's for sure, Dan. But it's important to say right now, nothing is set in stone. The only thing they voted on today was technology improvements to implement these changes should they happen. But it gave us an opportunity to see what these changes could be, which are basically increases to premiums based on people's salaries. But essentially, it's putting part of the burden on the employees. Just over a month into the new year, and focus is already shifting to next year.
Certainly have to make changes for 2026. There's no question about it. The budget can't be balanced without changes.
Balancing a $500 million shortfall is no easy feat. The State Health Plan Board detailed a possible multi-million-dollar savings through adjustments to Medicare options and prescription drug changes, but also increases on employee premiums.
If we put it into 4 tiers.
The plan spreads out an increase by salary. Essentially, if you make more, you'd pay more. Those making over $65,000 a year would see an increase of $35 to $50 a month. Under $65,000, it's $20 to $25 a month.
That we cannot afford the risk of pricing our educators out of the profession.
North Carolina Association of Educators President Tamika Walker Kelly says that proposal would burden the lowest wage earners in the school systems.
An educator is trying to decide, do I go to the doctor's office, or do I want to make sure that my lights stay on in my house, or do I save money to feed my child? And so those are very difficult decisions for our public school workers.
What's on the table right now? Is it asking too much of state employees who don't make a lot of money?
I don't relish that, no.
Treasurer Brad Briner points out the average increase of $30 a month across the board could decrease the deficit by $100 million. A tough ask, yes, but one he says may be necessary to keep the whole system afloat.
We have a problem now, and it's not pleasant to deal with. It's been brewing for a lot of years, and so we're going to address it head on.
And one of the board members suggested anyone who makes under $65,000 shouldn't have their premium increased at all. It's something that they'll look into over the course of the next few months, and then they'll have a final vote on any changes to the premiums in August. Sean Gallagher, WRAL News in Raleigh.